afternoon everyone, myself Dr. Kirti, Assistant Professor Physiotherapy Department. So today we'll discuss about the exercises suitable for people with diabetes. So the type of exercise should be individualized for every person, and a comprehensive physical activity routine include three kind of activities: aerobic, anaerobic and flexibility exercises. So aerobic exercises use large muscle group and require oxygen for sustained period. Like 30 to 45 minutes a day, at least 5 days a week is usually recommended for most of the people. And 30 minutes doesn't have to be done at the same time. 10 minutes in the morning, 10 minutes at lunch and 10 minutes in the evening can have the same benefit. So walk briskly, dancing, bicycling, hiking, jogging, running, skating, etc. Anaerobic or resistance exercises, it uses large muscle which do not require oxygen for short periods of time. So it builds strong bone and muscle, lower the blood glucose, makes the action of insulin more effective. A common concern among healthcare providers is that higher intensity resistance exercises should not be performed by the middle-aged or older people at risk for cardiovascular disease. Also, the concern centers around the increase in BP that might cause stroke, infarction or retinal bleed, and there is no evidence that resistance training increases these risks. Also, minimum 8 to 10 minutes of 8 to 10 aerobic exercises involve the major muscles according to the flowing schedule helps in improving the blood glucose control and sensitivity. Like 10 to 15 repetitions 2 to 3 times per week at moderate intensity. Then 2 sets of again 10 to 15 repetitions 2 to 3 times per week for several weeks. And then progression to 3 sets 8 to 10 repetitions at a weight that cannot be lifted more than 8 to 10 times. Push, pull and lift activities which can increase strength, prevent fall, increase mobility and improve the blood glucose control. Flexibility exercises improves balance and coordination, makes you more flexible, reduces the stiffness, reduces the risk of injury. Next, we are having the yoga and its benefit in people with diabetes, because yoga is an ancient technique which harmonizes the body system for development of body, mind and spirit. So it includes some asanas or pauses, breathing exercise, cleansing techniques, meditation, lot of relaxation practices. So it complements the lifestyle actually. It keeps the person in good health and well-being. So one can do the asanas for 30 to 40 minutes. So it can improve the insulin sensitivity, reduce the fasting blood glucose level, day-to-day performance, stress, and also improve the nerve function in type 2 diabetes with subclinical neuropathy. So these are some of the yoga asanas which benefit the person with diabetes, like Surya Namaskar, the tree pose, half spinal twist like Ardh Matsyendra Asan or Shavasana, the simple meditation technique. And apart from all these, one can do the Pavan Muktasan, Sarpasan, Konasan, Padma Asan, Pranayam and Paschimottanasana. Next, the appropriate level of exercise intensity. So people should be instructed to start any program slowly and gradually to build with time and intensity, and immediately they should stop exercising if they feel any kind of chest pain, and one can also call the doctor. So these are the guidelines to assess, like able to sing while doing activity, it is light. If able to carry on conversation, that is moderate, and become winded or too out of breath, like that is vigorous. So physical activity and low blood glucose can result from exercise only if you take insulin or on the oral medications. Physical activity in hypoglycemia is common after physical activity, and body is replenishing stored carbohydrate. So there are some signs and symptoms of hypoglycemia, like change in heartbeat, sudden increase sweating, feeling shaky, anxious and hungry. So effective form of treatment is the rule of 15, like 15 gram of carbohydrate one should eat, 3 teaspoons of sugar, half glass fruit juice, 3 teaspoons of roux afza, raisins, biscuit or half cup of soft drink. Beware of too many snacks. Also, these are the guidelines for adjusting the food during unplanned exercise. If the exercise is unplanned, increase the food intake, and if level is 60 to 120 milligram per deciliter, pre-exercise snacks. And if for mild to moderate of less than 30 minutes, then 15 gram protein. For moderate intensity more than 60 minutes, 20 to 30 gram of carbohydrate every 45 minutes. If moderate intensity longer than 60 minutes, you can also sip on carbohydrate replacement drink. To offset the post-exercise late onset hypoglycemia, eat food that contains slow releasing complex carbohydrate. Also, always be prepared for low blood glucose, like one should always carry a concentrated form of carbohydrate like glucose biscuit or granulated sugar. Thank you.